So, all right, welcome to the November 17th CoC meeting. First of all, I want to thank everybody for their flexibility in scheduling. Additionally, I'm going to have a hard stop at 3, but my fearless co-host Karen will take over as we move through the agenda. So at this point, we'll call the meeting to order and take roll call. Just let me go through a little logistics first. Sorry, go back. I'm sorry. Just as for those of you know, if you're not speaking, please mute your microphone screen so that we can make sure we hear everybody clearly. All right, so we'll move into roll call.
Sorry, Greg, just give me 1 minute.
It's okay, Josh, take your time.
Okay. Here we go. All right, let me share this so we can take a look at the attendance list. All right, so I'll just go right down the line. Access Foundation, Cordell or Uriam? Catholic Charities, CityNet, City of Corona?
Yes, here.
City of Eastvale?
And Josh, CityNet is here. They said here.
That is here. Okay, and if you could, yeah, absolutely. And can you put your name and name in the chat box for me, please? City of Hemet, City of Lake Elsinore,
Here.
It's Alex, actually. Sorry about that. City of Menifee. I'm sorry, City of Menifee. City of Moreno Valley.
Hey Josh, City of Menifee is here. They put in the chat they're having issues with their microphone.
Thank you so much, Jonathan, and thank you, Edna. City of Moreno Valley. City of Marietta. City of Paris.
Here.
With Dr. Grace Williams and Rebecca Rivera.
Rebecca Rivera.
Thank you. City of Riverside. City of San Jacinto or Harp Outreach.
Robin Gillen Consulting.
Thank you. Coachella Valley Association of Governments. CVG.
Here.
Coachella Valley Coalition on Youth Homelessness. Coachella Valley Rescue Mission.
Kimberly's here. Hello, everybody.
Hello.
Thank you, Kimberly. Community Health Association Inland Southern Region. Department of Public Social Services.
Margaret Adkins is here.
Thank you so much. Desert AIDS Project.
Here.
Thanks, Monica.
Yes.
Desert Health District.
Donna Craig here.
Thank you, Donna. Faith in Action. Habitat for Humanity. Jewish Family Services of San Diego.
This is Becky. I'm here.
Josh, I show Carol all about here. Maybe she's having mic problems.
Perfect. Thank you so much. I appreciate it.
City of Moreno Valley is also present.
Perfect. Is that Serena or Dina?
Actually, this is Sharon. I'm sitting in for Serena today.
Okay. I'll reach out with a proxy letter.
This is Erica with Jewish Family Service as well.
Thank you so much. Lake Elsinore Unified School District. Lighthouse Social Service Centers.
Hi, it's Karen with Lighthouse.
Lutheran Social Services. Martha's Village and Kitchen.
Here.
And thank you. Mental Health Systems.
Franco here from Mental Health Systems.
You. Thank you, Frank. Mercy Health.
Dave Jacobs here with Mercy Health.
Jake. And you did send us, you did notify us that you would be taking over as a primary. I appreciate that. Make that. Molina Healthcare.
Good afternoon, Jackie Portilla here.
Thank you. Operation Safe House.
Hello, Rainbow here with Operation Safe House.
Thank you, Rainbow. Path of Life Ministries.
Hello, Casey Jackson with Path of Life Ministries.
Thank you, Casey. Department of Animal Services. Emma, that's not you anymore.
No, it's not. And Josh, I don't know if their representatives are getting the emails. I sent a message to them just to confirm.
Okay. We'll reach out to them after this meeting. Thanks, Emma. Riverside County Office of Education. Riverside County Hot Team. Riverside University Health System Behavioral Health.
Christopher Salazar, present.
Thank you. Riverside Unified School District. Shelter from the Storm.
Hi, I'm here, Angelina Co.
Thank you. I see Angelina. Step up 1 second. Transgender Health and Wellness Center. JM, I saw you here.
Yep, present.
Thank you. UCR Health.
Josh,
United Way.
I see Alberto Rivera here for a step up.
Step up 1 second. Thank you so much. United Way of the Inland Valleys. US
Hi, everyone.
Vets.
Oh, sorry, it's Danielle's here.
I'm sorry, for what agency?
United Way.
Okay. Okay. US Vets. And then VA Loma Linda Healthcare.
Hello, this is Oscar.
And Valley Restart.
Susan's here.
Thank you so much, Susan. Let me just ensure that we have quorum.
Yeah, we do.
Good afternoon. I didn't notice probation on the list, but I'm Shannon Crosby attending on behalf of probation.
Thank you so much. Just for those who have joined us for the first time or recently, I may not be aware, we call off roll of voting members. And so other members of the CoC that have submitted their application may be on here. We just don't call them during roll call. This is to establish quorum. So please put your name and email and or agency that you represent in the chat so I can ensure that we received your attendance for this meeting.
And Josh, I show a hand up in for, I don't want to butcher the name, Romfus Franco.
Yeah. Hey, Frank, are you there?
Yes, I'm here. Can you hear me?
Yes. Okay, we do have quorum, by the way.
Thank you, Josh, very much. And as Josh said, we have a couple new members who are joining us, Riverside County Division of Victim Services. as well as California Room and Board Coalition. As Josh said, in order to become a voting member, you need to attend 3 consecutive meetings. So I think Department of Probation, I think this is either your second or third, if I'm not mistaken. But and then our new voting member is Mental Health Systems, who I know Frank's on the line representing. So welcome to our new members, and congratulations, Mental Health Systems, for becoming a voting member.
Thank you.
So actually, do we have anyone from Riverside County Division of Victim Services on? Or the California Room and Board Coalition? Right. And I know Josh will reach out to them and make sure they for next meeting. So, alrighty, moving on to item number 2, consent items. And we can take these together. So this would be the approval of item A, which is the September 22nd CoC meeting minutes, as well as item B, the 2020. That's hard to say already. 2022 CoC meeting calendar. Any questions to start? And just use the raise hand feature, or if you're having problems, just jump in. And if not, I would entertain a motion to adopt the consent items. Don't be shy.
Move it.
Thank you, Karen.
You're welcome.
Is there a second?
Rainbow with Safe House. I'll second.
Thank you, Rainbow. And any further discussion at all? All right, not seeing any. Since we have a large group, we do this voting a little different. Is there anybody in opposition to the consent calendar? And is there anybody that feels the need to abstain? All right, not seeing any. Those pass unanimously. Moving on to item number 3 is the public comment section. And at this time, we'll open it up for any public comments. First of all, Josh, did we have any written ones submitted?
We don't, but we should review the 2022 CoC calendar as a consent.
Oh, no, I just took them both together, Josh.
Yes.
Oh, okay.
Yeah, remember we talked about we're just going to change when we have consent items to just vote on the consent calendar all at once. So.
Sounds great. We did not receive any written public comment prior to this meeting.
And so at this time, members of the public, they're encouraged to address the continuum of care on any items that are not listed on the agenda. When we get to agenda items, we'll take any comments at that time. Does anybody have any public comments on items not on the agenda? If so, please raise your hand. All right. Oh, Carol, go ahead.
I just want to let everybody know that Faith and Action of the San Gorgonio Pass has facilitated their first 2 days of navigation at the Chamber of Commerce here in Banning, California. We're very, very excited about this milestone and hope that it will continue on until the end of the year and we get our navigation center up and running. So just wanted you to know. Thanks.
It's great news, Carol. Thank you.
Congratulations.
And Kennedy.
I think I heard my name. I just wanted to remind everyone, as Joshua so kindly sent out, we'll be having our 7th annual Transgender Day of Remembrance at Palm Springs City Hall, and we'll also be holding one at Ryan Bonamino Park in Riverside on the same day. That one will be at 3 p.m. and the one in Palm Springs will be at 5 p.m. And I've also
Oh, Kennedy, you cut off, I think.
I got muted apparently.
Yeah.
Yeah, just the 2 Transgender Day of Remembrances, and that we are apparently now the largest employer of trans people in California among nonprofits. So we're excited about that news.
Thank you, Kennedy.
Thank you.
Always a great event every year. So, all right, Casey.
Hi, everyone. This is just a reminder that Cold Weather Shelter in the city of Riverside will open on January 3rd this year. It will be held at the same location as last year at the Salvation Army on First Street. And we just wanted to make sure everybody were reminded of the later start date. This is to accommodate the Salvation Army as well as the continued social distancing requirements. Thank you.
Thank you, Casey. Jacob.
Hi, everybody. I just also wanted to share that QueerWorks and Borrego Health, Trans Community Project, DAP Health. There's about 12 other orgs. JFS, some great orgs on here are collaborating to also do a Trans Day of Remembrance at Oscars in Palm Springs. And that will be from 5:30 to 7 o'clock as well on November 20th. So, and I'm a strong encouragement to go to any two-door that is close by or strikes your fancy. If many people may not know, the Trans Day of Remembrance is the day where we annually honor and recognize those lives that were lost due to transgender and non-binary violence. And so I think it's really important to have our allies show up and attend these events, because the trans community is such a huge part of the homeless population out here in Riverside County. And so I think that it's really important for us to just kind of learn about the community and see the violence that my community faces on a daily basis. So yeah, that's just my little spiel.
Great, thank you, Joshua. Jacob. All right, any further public comments of non-agenda items? All right, not seeing any. We will move on to item number 4, new business. Item A is the Policy and Advocacy Committee updates. Turn this over to Karen.
Thank you so much. Good afternoon, everybody. So excited here to be with you all. Inside of the Google Docs drive, you have 2 documents related to this committee. One is the committee report, and the other is a spreadsheet that Josh is going to pull up for you. And what I'd like to do is just give you a brief update on the exciting meeting that we had on November the 4th. One of my favorite things to do is visioning and goal development. For some reason, I do not see, there it is, okay. And so what we did on the 4th is went through a really fun exercise to do some visioning and development of goals for 2022. We wanted you to see the whole snapshot of all of the different committees. There are folks that have signed up to be leads of those committees, and then there are also those that have signed up to participate in the committees, and then there are some goals. So I'm just going to run through some of them for you. You can see that the working groups are comprised of advocacy and youth advocacy and policy. And Monique Gira is the lead for that. And then there are others that are signed up to participate. Legislation bill tracking working group is Michelle Davis. And then you can see the participants. The housing policy resources is Greg Rodriguez. That's a popular one. You can see housing is a big issue. And so Greg will be leading that. And then healthcare, behavioral health, Marcus Cannon is leading that. The re-entry justice system, Vanya Corliss is leading that. And then community education engagement is being led by Javier Lopez. And anybody that is interested in participating, these working groups are ad hoc, they are non-Brown Act, and the idea of the working groups is to allow people to really roll up their sleeves and start fleshing out strategies to advance the goals that were developed. And Josh, if you'll scroll down a little bit so we can see some of the goals, just to give everybody some examples. So like right there, you can see the different goals that there are that have been fleshed out. Some of the committees have multiple goals. Numerous goals actually, and some have a few because they're very big and broad. But the idea is to get the different working groups together to start talking about ways that we can advance those goals and then bring that back to the Policy Advocacy Committee, which if you see the updated calendar, that Josh provided for everybody, this committee meets every other month. So we had a meeting in November. The next one will be in January. But if you like to be involved in systems change and developing and recommending policies and looking at legislation, really moving the needle, I would encourage you to get involved, because this is your opportunity to roll up your sleeves, be a part of a working group. Each of those working group leads or chairs that I mentioned to you will be convening the working group so that they can start working on advancing those goals. So if you have not signed up and you feel like you want to be a part of it, this table is big for everybody. We want you to feel welcome. You just let the Continuum of Care know you can put it in the chat box. You can let Josh know. He will add you to any of the working groups that you would like to be a part of. And so we would be more than happy to invite you to participate in those different working group meetings. I would encourage you to look at all of the different goals that are listed. I'll just give you an example. You can see, for example, on the legislative bill tracking working group, which is the second column, column C, you can see that this particular group wants to collaborate with members of Congress and the legislature to focus on current and emerging or proposed legislation. And the way that this committee works is we ultimately bring it back to the whole continuum of care so that we can give feedback and have influence on important legislation. And we don't want to reinvent the wheel, so you can see that we want to collaborate with the League of Cities and the Association of Counties and other stakeholders. If you go over to the next column on affordable housing, you can see that there are some goals to collaborate on developing centralized locations to access resources and maps for areas that are zoned for affordable housing. And then if you move over, you can see in the next column, under behavioral health and healthcare, you can see as an example a goal about trying to assess where there are gaps in the system regarding folks that are classified as 5150s and try to provide, and that's folks that are suffering from a mental health crisis, more resources to fill in the gaps. So the idea is that working group is going to come up with more specific ideas about where there are gaps and then collaborate on how we can begin to fill those gaps. And then if you've focused at all on our folks that are struggling with reentry because of criminal histories, that whole working group wants to focus on improving the system as it relates to those that are trying to reenter for jobs, housing, and other things like that. And community education and engagement wants to focus on bringing other stakeholders to the table, trying to reduce NIMBY, bringing private foundations to the table. And I skipped over on our youth advocacy working group, but you can see that they are trying to focus on legislation affecting youth, as well as a lot of the state and federal initiatives that are coming down the pipeline, really to try to improve our system of services. So I apologize for the quick overview because there's a lot in this document. Please take your time in looking at the goals. And again, if you feel like you want to be a part, we would really love for you to participate in the working groups. If not the working groups, the Policy Advocacy Committee. Does anybody have any questions regarding the goals that have been developed in the working groups and where we're going from here?
Josh.
I'll just take the opportunity to say I've already received a few asks of individuals who want to join the groups. So thank you so much for your submissions via email or in the chat. I'll make sure I add everyone to the working groups and I'll send that right over to Karen.
Yes, and for sure, thank you for signing up for that. And for the ones that you signed up for, we'll make sure that we let the leads of those working groups know which group you want to be a part of. Bravo, congratulations to you guys for wanting to be agents of change. Thank you so much. Anybody else? Michelle, did you? I think Michelle has a question or a comment.
Yeah, just a quick comment. So Linda Kruper with the one of the council members with the city of Hemet, she inspired me because she's an elected official that's sitting on the legislative bill tracking working group. So I had presented to our city council at the city of Riverside to have at least one city council member try to participate in one of the working groups. So I'm putting that challenge out there, and I hope that other cities within the county will also do the same.
Oh, good job, Michelle. That's great. Love it, love it, love it.
It's a good challenge. They should all be on the housing policy so they can meet their arena numbers.
And speaking of, by the way, you may remember in past Continuum of Care meetings, just a shout out to Michelle, because she is also participating in that housing policy resources group. She took the time to create a very detailed chart of different funding sources that I believe Josh had previously sent out, but as we're looking for different money coming down the pipeline, we'll be updating that. But Michelle is the one that took the lead on that. So I just wanted to acknowledge her for that.
Thank you. Any other questions, comments? I want to thank Karen for really taking the lead on this. This is something that both her and I discussed was a major priority when we took over as chair and vice chair. And as you all know, we really want to make CoC more of a working body and not just an information dispersal. So I thank staff too for their work on this and Karen's leadership on this. So very excited about the direction of it. So. All right, item B is a presentation on CalAIM, but Dr. Gilbert is in a meeting till approximately 3, so we're gonna pass over that and come back to that when he's able to join us. And if he joins us earlier, and I know Josh, you're watching, I am too, we'll go directly to Dr. Gilbert on that. I think you'll all find the potential and possibilities of resources under CalAIM very exciting. So we'll move to item number 5 is the standing items. Item A, excuse me, is the Board of Governance update. Really the only update on that as usual is the ongoing action planning and the working group within staff, and myself and Tammy and Karen have been working with LaSar on refining the draft action plan. We're looking to do a virtual retreat that will be a combined retreat between the Board of Governance and the CoC sometime in January. And we are setting, hopefully, a hard deadline to have the final copy ready to go at the 31st of January. So we're very excited about the direction. And again, we look forward to as many of you as possible participating in that virtual retreat, and we'll definitely make sure we give you a heads up on that as well. So any questions at all on that? Making it easy on me today. All righty, item number B is the Continuum of Care and Homelessness Management Information Lead Agency update. Emma, I believe you're lead on this.
Yes, thank you. Good afternoon, everyone. I just want to take a moment to thank all who are in attendance today. And I did have an announcement that was sort of preempted already by Tanya. So I wanted to announce that she is officially on maternity leave and that she and baby Lucy are doing very well. And we all got a chance to see her cute little baby earlier. But for those of you that joined later, I wanted to make sure that I still provided that announcement. Josh, you can go ahead and advance. So just a quick few things. We wanted to announce that the application for the NOFO has been submitted. It was submitted on November 15th, which was a day ahead of HUD's deadline. So yay for that. The application, along with the priority list and other supporting documentations, can be viewed on the CoC website. And I'd like to just thank our consultant, Joe, our community partners, our BOG members, our review and rank committee members, all of our evaluators, and especially our CoC admin team, Natalis, Melanie, Jamie, all of the others that assisted. We could not have done it without you. A huge weight lifted off of our shoulders. And so we are very excited to announce that. We did provide a screenshot for you of our admission and just a little bit of a reveal of the behind the scenes. The team actually did a countdown when Natalis hit the button to submit. It was really cool. I took a video of it. Sort of cheesy, but it was a milestone for our team. The other, go ahead and Josh did the screen. So there is the screenshot, and you can advance. Okay. And I wanted to just take a moment and highlight the CoC November staff report. It was emailed out to the CoC this morning. If you could take a moment and review it at your leisure. You can also find it on our CoC website. These reports are published every other month. And along with performance metrics, the reports include upcoming funding opportunities. So if your organization is interested in knowing what is coming, this is a great place to find that information. We also try to send it out by email, but this is a great little report that kind of just brings everything together for you in terms of what we're doing here at the CoC admin. If you have any recommendations on what you don't like in there or what you would like to see, we welcome feedback. So please email us at our CoC email, or if you'd like to do so more discreetly, feel free and email me directly and I can convey the information to the staff. And please, we will not have our feelings hurt. If you hate it and you want to see something different, please just communicate that to me. The other announcement we have is the Emergency Housing Voucher Program, and this program is assigned under Jamie Gibson. She is not in today, but we did include the flyer in the staff report. The flyer is here as well, along with Jamie's contact information. So the program was launched September 7th, and all of the details are included in the staff report. If you need additional information, please feel free to reach out to us. You can contact Jamie directly. All of our contact information is included in the staff report. There's a section with a staff directory, but you can always email the CoC email and we will forward it to the appropriate person. So I'm now going to hand it off to Lindsay Sisti, who is a program specialist for the CoC, and she is going to be providing an update on ESG.
All right. Hi, everybody. Thank you, Emma. So our ESG update. So exciting news. We do have additional funding. Though it's not $33 million, we are going to get $339,000 for our 2021 state ESG Continuum of Care allocation. 160,000 of that is going to be dedicated to street outreach, and 176,38 is going to be earmarked for rapid rehousing services. I'm anticipating that we're going to put out the bid documents and notification early January. And, typically within a week of that release, we'll hold a pre-bid conference where we will discuss the details around this opportunity and the application process. Moving on to the next point, we've been holding ESG CV district meetings for all of our subrecipients, all 18 of our subrecipients, and we initially started those as 5 separate district meetings, and we found there was a tremendous amount of overlap with those in attendance. So to make everybody happy and to value everybody's time, we have now consolidated the 5 district meetings into a single meeting, keeping in mind that the discussion is still happening on a district level and coordination within those meetings. To our third point here, our ESG CV Q1 impact report was released, and it includes information on the ESG CV program through September 30th of 2021. That has also been included in the Google Drive for you to reference. The Q2 impact report is slated to be released on January 13th, and that will cover our most up-to-date information through December 31st. If we want to go to the next slide. All right. So lastly, in an effort to really ramp up our placements for households experiencing homelessness and hit our ESG CV goal to have 420 placements, we're going to be launching a Homes for the Holiday landlord recruitment effort. Currently, most of you know under our ESG CV rapid rehousing, we're able to offer a landlord incentive equal to 3 times the asking rent of the unit. For each unit one of our clients moves into. So we really wanted to take advantage of this incentive in the holiday season, see if we can tug on any heartstrings and put in an extra push to get existing landlords and new landlords to rent to some of our clients through our rapid rehousing program. This flyer is also in our Google Drive. So if you have any existing distribution emails or newsletters, feel free to snatch this up and include it so that we can get more of our households into housing during the holiday season. And Karen, I see your hand is up.
Yes, actually, can you go back to the last slide where you can see, this probably seems so cheesy, but I can't help it. No, the other one which you have the new logo from your agency on it, the flyer you just had up. There, see down at the bottom, I just wanted to say, I don't know if you all noticed, but there's a new logo for the department. It says Housing and Workforce Solutions, and I really love the tagline because it says engage, encourage, and equip, which really emulates the values that you guys all have as a staff team. And I just wanted to tell you all thank you so much, and I love it, love it, love it. So anyways.
Thank you, Karen. So that is all for my ESG updates. Any questions?
No, but Lindsay, I know that this flyer is in the Google Drive, but can we send that out as an attachment to the CoC as well?
Yep, absolutely. Josh, Josh can assist with that.
Thank you.
Thank you. Thank you.
And Rashana.
Good afternoon, everyone. I just have a couple announcements regarding a couple funding opportunities. As many of you may notice, earlier this morning, we sent out our HAP Round 2 RFP for capital permanent supportive housing projects. So really excited to see those applications come in. And those, I just want to make sure that that you really read the RFP. Those applications are to supplement the No Place Like Home capital projects. So be sure to check out more information is located on our county HAP page. So which the information is in your email. Also, I just want to announce that we do have like Lindsay mentioned earlier, we do also have a request for quotes for our rapid rehousing projects, and that is coming in early January 2022, and that's another portion of our HAP Round 2 funding. The last announcement I want to make is that the California released their request for applications for their encampment response funding. The CoC will be submitting an application for the Santa Ana River Bottom response, and that includes the 5 cities, which is Corona, Norco, Jurupa Valley, Eastvale, and Riverside. So, but I do want to encourage other cities to apply for that funding as well. We can only apply for one as the CoC, but if other cities would like to apply, the RFA, sorry, is located on the state of California's website, and I included that link on this slide. Any questions? Great, thank you, everyone.
Good job.
All right, that brings us to our HMIS update. Gordon, you have the floor.
Hey, Josh, thank you. Before I begin, just another plug for the staff report that Emma was talking about. It has a variety of really useful information. For example, if you wanted to check out how many individuals were totally served and a breakdown of how many clients were exited, that information can be found in the staff report. And in it also includes the number of veterans served and a breakdown of individuals who exited to permanent housing, temporary housing. And it's also inclusive of a breakdown that has a review on age and gender, which includes our transgender population, as well as a breakdown by race and ethnicity. And again, as Emma said, that report is in our Google documents, so please feel free to check that out. Okay, so moving on to HMI's lead updates. It is LSA time. So for those who are not aware of this process, is the longitudinal systems analysis. And essentially what this is it's a HUD connected process that looks at every nook and cranny of our HMI system, all of our client records, our agency records, our program records, and how they interact with each other. And the areas that that will be reviewed, and it's not limited to, but these are some of the larger and critical areas, is agency data quality, client record enrollment, bed night overlaps, bed inventory versus program capacity, and the head of household. And essentially, the LSA process is where we submit all of our information to HUD, and HUD lets us know that there are any areas that we need to correct or fix. And to ensure that Riverside County passes with the highest level of data quality with the LSA, with no findings or warnings found, our agency and their users' contribution will be critical. And for those who is not their first rodeo from the agencies, we thoroughly appreciate their experience. And I say this because the data quality reports for programs that have been flagged by Clarity in their data quality reports have been sent out to agencies on a routine basis. And some of our agencies have actually corrected all of their data quality reports, all of their data quality in their data quality reports. So we thoroughly appreciate that. Now, to help facilitate this even further, because there are data quality issues that we need to address, as well as LSA specific data quality that we need to address. HMI's team, we are hosting a workshop tomorrow between 1 and 2, and we are going to go over the different types of data quality reports, the useful application of each type of those data quality reports. We'll be diving into the LSA specific data quality reports regarding overlapping enrollments, as well as the head of household. And we'll be reviewing the different fields in Clarity as far as the bed inventory, and then how we can make sure that we have those fields up to date that matches our agency's inventory records, so that our bed space matches with the program capacity. And the invitation that was sent out early already, along with the flyer to all of our HMIS administrators. Oh, and this is going to be an important piece. So according to the latest HUD LSA webinar and the HUD panel Q&A, the LSA will cover the time frame between 2018 to 2021. Now, I mentioned this small fact because typically the LSA covers only 1 year, but based on the information that we have been told so far, it will cover 3 years. We've been keeping an eye on the HUD's official LSA page and dates, and as soon as we have any more information, we will definitely be letting you all know. Oh, last but not least, the 2022 HUD HMIS data standard changes. For those of you who joined us for both of our workshops back in September, we reviewed the changes, and then we had a subsequent workshop that looked into each of the newer changes and updates in more detail. And all of those have been implemented into Clarity, as well as our custom workflows. And we've also updated the paper forms for those who require a download and printable forms, and they are located on the website that is listed on the slide. Is that it for me?
It is.
Thanks, Gordon.
All right. Thank you. I'll turn it over back to you, Greg. Thank you,
All right.
Josh.
Right, thank you, staff. Appreciate that so much. I just on the NOFO again, I want to echo Emma's comments and thank staff for their hard work. I actually read the NOFO. I'm that wonky, And it's a shame we're only allowed a certain number of characters in each section because we've done amazing work in this county that the feds should know about, definitely. But again, too, as Emma said, I really want to thank the community partners, so many that are on this call, because you really did play a huge role in not only compiling our data, but our best practices and all that. So again, thank you all so much. And then I also want to encourage, if you haven't read the staff report or don't usually, is to do it. It gets better and better every month, and just really, really good data and some good feel-good stories and good information. So encourage you to read that as well. Any questions at all for staff on the CoC or HMIS updates? Right, not seeing any. Excuse me, we'll move on to item C. The 2022 homeless point in time count. Before we move to you, Laura, because I know you're probably going to go past the time I have to get on. So Karen, when Laura's done, you can take over. And thanks everybody, and apologize I have to leave early. So.
Thank you, Greg.
Bye, Greg.
Bye, Greg. Thank you for giving me a couple minutes to share a little bit about the upcoming 2022 homeless point in time count. Next slide, yes. The way that we are planning this count is through our community planning meetings. All of you should have that flyer that includes all of the dates. We've had one every month beginning in September. We just had our November meeting this week. It's great to see a lot of our community partners there providing input and thoughts about the best way to plan this count. So we always welcome CoC members to attend these meetings. Next slide. A little bit about the way that we are approaching the count is that we want to promote more than a count and take advantage of our time engaging individuals experiencing homelessness by finding ways to refer them to resources and link them to services. And so this is something that we are planning through our community planning meetings, and soon we will also be starting some additional meetings so that we can create some plans and be ready for the count at the end of January. Next slide. The way that we plan the count is by following HUD's recommendations. As most of you know, the point in time count is a HUD requirement of all CoCs. Our guide is a methodology guide that HUD releases. We have been promised that that guide will soon be released. It includes a lot of information about the populations that we should be counting, and includes information about the time of the count and so forth. So that's really our guide that we will be reviewing. It makes sure that Riverside County is following best practices and that we meet the minimum requirements established by HUD. We are developing that methodology, and we will be submitting the final methodology plan to the CoC for approval at the next meeting. So look, we will be back to share a little bit about what our approach will be in terms of the count. Next slide. The dates and the times of the different components of the count have already been identified. Street-based count would be Wednesday, January 26th from 5:30 to 9:30 a.m. As in previous years, there's not a lot of changes in our approach. It is a morning count. We will also rely on the service-based count as well as the unincorporated area count to make sure that it's a complete coverage, complete census of Riverside County. And of course, we always want to bring attention to our dedicated youth count, which is a 3-day count starting Wednesday, January 26th through Friday, January 28th. As a lot of you know, the date of the youth count is, the time of the youth count is a bit different, 2 to 8 p.m. because we do have a lot of youth that are in school or attending school while still experiencing homelessness. And we've added the Come and Be Connected events, where they are community resource fairs for youth, specifically for youth, to link them to services and make sure that they are receiving any services that they might need since they are experiencing or are at risk for experiencing homelessness. Next slide, please. And so I wanted to review very quickly the methodology. Like I mentioned, the date and the time and the date of the count will be Wednesday, January 26th. It is once again a requirement that the count be conducted in the last 10 days of January. The night of the count. And so when we are canvassing the community, the question that we ask everyone that we want to survey is, where did you sleep last night? And once again, the reason why we do that is because the guide tells us that we have to identify the night of the count. And the important thing to remember when we're thinking of the night of the count is that, for example, the youth count that is a 3-day count, when we are interviewing youth on that 3rd day, that Friday, we will still ask anybody that we survey, where did you sleep on the night of January 25th? And so we always look back at that date, that night, when we're asking individuals about their housing status. And that is the reason why we also don't want to extend the count too much, because the longer we are away from that night, which is that Tuesday, January 25th, the higher risk that we run that people may forget. And so that is once again a HUD requirement to identify that night of the count. The next slide, please. Week after the count, HUD methodology allows us to extend the count. So it's not just on January 26th, but for example, the youth, we're able to extend the youth count because of their very unique experience when homeless. So we are able to extend it for a couple of days if we have, according to HUD, if we have good reasons to be able to extend the count. And then of course we would be going to locations that were not covered on Wednesday, January 26th. So that is why we use the service-based count. On the day of the count, when we are out in the street, we might miss individuals. So the service-based count is our way of extending it a little bit to identify those individuals that we may have missed on the day of the count. Let's see, number 4, a survey-based count. We use that survey to conduct the count. And if anyone is asked if they want to be surveyed and they say, no, I do not, then we are able to conduct what we refer to as an observational count. We always encourage volunteers to use observational counts as their backup and last option, but that does also give us some information. So for example, an observational survey would be used if someone refuses to participate, just says, I don't want to be surveyed, or due to safety reasons, if the counters or the team just don't feel that it's a safe location or a safe place to be at that time, we would not want them to be put in any kind of risky situation. So then they would use that observational count. So we do have that as a backup. And it is something that HUD recommends and allows COCs to use. Next slide, please. I've shared with you already persons to be included in the unsheltered count, and our guide is always those locations that are not designed for or ordinarily used as a regular sleeping accommodation for human beings. So those include cars, parks, abandoned buildings, bus or train stations, airports, camping grounds. So once again, we follow these standards based on HUD recommendations. Persons not to be included in the unsheltered count. HUD provides us with a list of possible individuals that we would not include. A lot of you have already, we've had discussions in the past about those individuals temporarily staying with family and friends. That directly affects our youth population because they do tend to double up or couch surf. And so the reason why we don't collect this information, or I'm sorry, the reason why we don't report it to HUD is because HUD doesn't allow that in the data. However, as some of you know, we do collect that data, but we don't report it to HUD. And that is kind of what we do during the community planning meetings, in that we work with our community partners. They provide feedback about what information we should be collecting locally. And so we are working on that 2022 survey right now. We're getting a lot of really good feedback from our partners. But once again, we start off that survey with the core questions that HUD needs us to collect. Next slide, please. And the subpopulation data, HUD states that CoCs must collect and report information on the demographic characteristics of all people. So it's going to include household type, age category, gender, race, ethnicity. Household types include persons in households with at least one adult and one child, persons in households without children, persons in households with only children. And then it also, HUD requires that we also report the total number of adults that are experiencing serious mental illness, substance use, HIV/AIDS, adult survivors of domestic violence. That is optional, but we do collect it for Riverside County, and then chronically homeless households. Next slide, please. So that is how we kind of build our methodology for the count. Once again, they have not released, HUD has not released the 2022 guide. We don't anticipate that they will make too many changes, because remember, the data, we do follow trends, and we do want to be able to collect information that we can compare from one year to the next. If we make too many changes in the methodology, then it's harder to make those comparisons. But we do see from year to year HUD adding a question or making edits to some questions. Once again, we'll let you know. We'll share the methodology guide with all of you. Once we receive it, we will review it and finalize our methodology plan, which we will present to the CoC at the next meeting. Next slide, please. A big piece of our planning this year is going to be how we are going to work with community volunteers in light of COVID-19. End of January, we don't know what it's going to look like. We've met with our public health partners. They've been giving us a lot of feedback, and we have too. We want to conduct a count where we can keep our volunteers safe, and at the same time be able to go out into the community and conduct an accurate count. So we will be working to make the final kind of recommendation, but really encouraging all of the participants in the point in time count to be fully vaccinated. or non-vaccinated individuals to be tested as indicated per HUD guidelines. So HUD is also going to be releasing some COVID, and actually we did release some guidelines regarding COVID and keeping everyone safe, since that was the biggest concern of why the 2021 homeless count was skipped last year. But we are confident that we will be able to plan, account, and reduce the risk of spreading the virus and keeping everyone safe. So that is going to include volunteers wearing masks and adhering to social distancing requirements. That will be covered in the volunteer trainings. We will definitely encourage volunteers to stay home if they are feeling ill. They will be okay. We will, make sure that we plan ahead for some absences, volunteer absences. And then we will also be providing additional masks and hand sanitizers to our volunteers in case they are out interviewing someone and that person needs a mask. And then, of course, we will increase homeless service provider staff and homeless outreach team participation versus community volunteers. We want the count to be positive in our community. We don't want to put anyone at risk. But once again, I think we are in a good place to move forward with the full count, put in place some important safety precautions, and conduct an accurate count. So that's the great news regarding the point in time count. Very quickly, a couple of timelines. Our goal is to start volunteer recruitment end of this week. That means that we will have in place our volunteer recruitment flyers, which we will share with all of you and ask to please share in your communities to spread the word that we are open and registering volunteers. We will also be having a youth incentive drive to bring awareness to the youth count and work with the Youth Action Board, the CoC's Youth Action Board, as well as possibly the Youth Advisory Council for all the 5 districts. So that's really exciting. We will be having another community planning meeting in December 15th. If you're able to attend, please join us. We need your input. And like I mentioned, we will be submitting the final methodology for the 2022 point in time count at the next CoC meeting, hoping to get your feedback. The survey tool, we will also finalize after we share that with you at the next meeting, and you give it a thumbs up to move forward with that tool. We will be collecting incentives. Those are an important piece to the point in time count. Anyone that is interviewed, volunteers have bags with them that they give to them as a thank you for participating, and it includes cold weather items and information for anyone that is surveyed. We will conduct online trainings. In the past, we have had in-person trainings. COVID is limiting us in that, but we are certain that we can create a useful and helpful volunteer training that people can view online. And then that will be available for anyone. Once they are registered, they'll have access to that training, and they will take a very short quiz at the end so we can confirm that they actually view the training. And I say this because last year we actually participated in an audit, and they asked us about how do you train your volunteers for the PIC count? How do you confirm their participation in the trainings? And so we want to make sure that we are once again in compliance of HUD requirements. The final planning meeting will be January 13th. Volunteer recruitment will close January 18th. And we will be set to implement the 2022 homeless count on January 26th. If you are wondering how you can participate, there's many things that you can do. One of them could be volunteer as a counter. attend the training so that you can go out and interview individuals. We will be needing people for the Come and Be Connected youth events. We will be needing people for the service-based counts. So there's definitely opportunities to participate. If you would like to maybe donate an incentive or a raffle item for those Come and Be Connected events, we definitely would appreciate that. So there's always an opportunity to help with the count, and we always appreciate all of your participation and support. It's an important event, and it's a countywide event. We're proud to be working with all of you to conduct an accurate count in 2022. Does anyone have any questions? I know it was a lot of information.
Well, Laura, just kudos to you. It's a huge, huge regional undertaking, and I know that you have to collaborate with hundreds and hundreds of people. You do it with such grace and ease. You make it look easy, and we know that it's not easy. I'm curious, as you've been meeting with all of the different stakeholders, are you getting a sense that we may be in for a spike in the homeless population? I can tell you that some of our data is indicating that we're seeing a much higher percentage of first-time homeless, which seems to be an indicator of what's going on with the economy and the environment. What are your comments about that?
I think so. I agree, Karen. We are preparing to definitely interview a lot more individuals in the streets. And you know, our numbers for both the youth and the general account, I think especially also for the youth, because we're doing so many more initiatives to really find and engage youth, that we will definitely see our numbers increase. But you know, we're gonna do our best to conduct an accurate count as best as possible. We have a lot of tools like the mobile survey that allows us to conduct a more accurate count. So we've been using the mobile tool for, this will be our third year, and it has really helped us as we collect all this data. So we are definitely planning on counting more individuals.
Does anybody have any other questions or comments regarding the count, or any particular trends that you're seeing, or anything that you want to contribute to this super important initiative? If you're not plugged in, please make sure that you get plugged in so you can be representative of the count in your particular area. And again, I just want to give kudos to Laura and the other team members that are a part of this, and all of the volunteers. It's a huge, huge effort. So thank you so much.
Thank you, Karen. Everyone should be receiving those invites to the community planning meetings. If you're not receiving them, let us know. But we make sure that the CoC is always on the attendees lists.
Okay, so moving on to the next agenda item, and I want to make sure. It looks like, you know what, it looks like we have Dr. Gilbert. You are here, so I'm going to go back up to agenda item 4B. I'm super excited to introduce Dr. Gilbert, who's with the Riverside University Health System. And I don't know about all of you, but I am really excited to hear his presentation about CalAIM, because we know that this is going to bring some wonderful new resources and opportunities for integration of services to the community. So Dr. Gilbert, take it away.
Thank you so much, Karen. And by the way, having heard the last part of that point in time count, that's going to be really critical in terms of one of the pieces of funding I'm going to talk about is going to be at least partly based through the health plans on the point in time count. So I mean, totally pertinent to some pieces that I'll provide the group today. Thank you so much for being flexible about the time. And what I'm going to do, I'll go through the initial slides fairly quickly, but focus on all the pieces, Karen, to your point, that really do connect to housing and and providing support for individuals that need support. So next slide, Joshua. So really quick, CalAIM, the basics, really focused on improving Medi-Cal, paying for services that have never been paid for before through the Medi-Cal program, including focusing on whole person care, social determinants of health, specifically including housing support. So a clear, one of the primary goals of the initiative through the health plans. Remember, this is going to be through Inland Empire Health Plan and Molina, both of the plans in the Medi-Cal managed care plans in the county. So the member does have to be Medi-Cal eligible and enrolled in the health plans. Other aims include kind of making Medi-Cal more consistent and standardized, not as important for this group, but important for the health plans and the state. And then, bottom line always, improve quality outcomes, reduce health disparities, and really drive innovation, through the system. So next slide. Pretty aggressive timelines. So in lieu of services, or community supports as it's now called, is one of the most fundamental pieces, and that's where a lot of the housing support and housing activities will be found in the CalAIM program this January. So IEHP is providing all of the housing supports, because what plans can choose off a menu that I will show you. IEHP is going to be doing all of the housing supports, Molina as well. So that's good news starting January 22. There's some incentive funding that's going to come through for providers, counties, health plan itself that I'll talk briefly about. And you can see some of the other activities that are going to occur in CalAIM. It's pretty fundamental. Next slide. So one of the key parts of CalAIM is a new benefit. It's an actual new benefit under Medi-Cal called enhanced care management. And enhanced care management, again, they must have Medi-Cal and they must be enrolled in IHP or Molina. And there's 7 populations of focus. The 3 that start January 22 include what we call high utilizers in the hospital, in the emergency department frequently. And it includes rolling over all of the people that are now in the Health Homes program, which IEHP and Molina both run now. They just roll over into enhanced care management. Homelessness or at risk of homelessness. So that's January 22. So those are some members that are already being served through the Health Homes or Whole Person Care program, but again, now eligible for this new benefit of enhanced care management. And then you can see the other populations, the one that starts January 22, seriously mentally ill, individuals with substance use disorder, of course, who are also at risk for homelessness. So really, homelessness is a key component in the initial populations that will be served by IEHP and Molina through enhanced care management. Next slide. So the key to ECM is this is a little different than all the care management that's done previously by the health plans, because it's explicitly focused on taking care of the whole person. So typically care management in a health plan is a little more limited, focused on the health needs, chronic, illness needs, preventive services needs. But this is really a focus on everything that member could need. Not that everything will be provided by the health plan or providers. For example, if they need job training, that's going to be an outside source, not funded through this. But the point is that these ECM teams have to really evaluate the member in a comprehensive way. They've got to figure out if they're homeless or at risk of homeless. They've got to figure out if they have substance use disorder. They have to figure out, if there's other issues that are going on. Meals is one of the services that can be provided in certain circumstances. So the difference is this is really comprehensive. And there's teams that are going to be all throughout the county, both within the county system, but also in private provider offices, clinics, et cetera. And the teams include a nurse, an RN, behavioral health professional, care coordinators, community health workers, and potentially housing experts as well on the ECM team. I'll also tell you about how, for in lieu of services, the ECM teams will access people who know about housing, entities and people who know about housing. Again, contracted through the health plans. They're the ones that are getting the money for this. So the dollars will flow to these teams through the health plans. Next slide. So where's the county in this? And by county, I mean, Riverside University Health System, which is who I'm working for now. They will be the enhanced care management provider for members that they're caring for in their clinics. But for example, Borrego Health, which you might be familiar with, a federally qualified health center, or Neighborhood Health Center, which is in the Temecula area, et cetera, they will have teams as well to serve their members that are homeless or at risk of homeless or high utilizers, et cetera. So the key is that, that connection between these enhanced care management teams, which are multidisciplinary, and then, entities that will help provide the housing services I'll talk about in a minute. Again, contracting with the plans. Next slide. So big issue, as you all know, you are more expert around these issues than I am. Although, as you may know, IEHP has been pretty heavily involved in the housing process and delivery for a number of years while I was there as CEO. But, you guys know people coming out of incarceration, very high risk for homelessness. So that population will be served in January in 22 as well, and will be the enhanced care management team will be the current whole person care teams that work under RUHS and Judy Nightingale. So they'll be, connecting with those individuals coming out of jail or prison. They'll be determining whether they need, homeless, the services, housing services, and then, creating those connections. So this is a good one because of the high risk of that population. Next slide. So the other group that I would just mention quickly is that the county will also be the enhanced care management provider for individuals with serious mental illness or substance use disorder. So they'll be the ECM teams within behavioral health, within the county behavioral health department. Again, also looking at those individuals that are, potentially at risk of or homeless and determining how to get those services. So you've got fairly significant populations that the county will be involved in. But remember, there'll also be ECM teams in clinics and private physician offices that have large amounts of IEHP and or Molina members. So in lieu of services is kind of an interesting concept. The concept is that the member would need a regular Medi-Cal benefit, hospitalization, emergency department, physician care. You provide them a service that Medi-Cal would normally not pay for, but is now going to be paid for, so that they don't have to use, it's kind of an odd way to say it, but so they don't have to use that other service. So a really easy example, a member's in long-term care, they don't need to be there, which IEHP found hundreds and hundreds of individuals in long-term care facilities that did not need to be there. They didn't need to be there medically, they didn't need to be there socially, and we actually moved them out. Obvious example, instead of paying for long-term care, which is anywhere from $3,000, $3,500, $4,000, $4,500 a month, if not more, you provide housing transition and navigation services, you find them housing, and then you're not using that long-term care service. So it's sort of a weird concept. I think of it as additional services that help that member, stay in the community in this case, or be able to access care, through their PCP or specialist instead of, being hospitalized or going to the emergency department. Some of the other examples are a little tougher, but we're going to provide those services, and I'll show you the list in a minute. Next slide. So it's a long list. So these are pre-approved services that health plans can provide, and how they're paid is complicated, so I'll leave that alone, but that they can provide in lieu of, other medical services. So you've got housing transition navigation, housing deposits, housing tenancy and sustaining. One case of a short term, which is actually 6 months, post-hospitalization. So I'm in the hospital, I have, don't have a place to go. I've got two options. I can go into recuperative care, which is typically for a 90-day period or less. And that's for people that have a little bit of medical issue. So they need to be in a, I won't say, highly medical setting, but a housing plus some support, or they go straight to some housing option because they're, medically stable and safe to do that. And that's paid for once in their, for them for a period as long as 6 months. And of course, the goal with both recuperative care, you know this better than I do, the goal with recuperative care and short-term post-hospitalization is to then find them permanent housing. So you've now got a bridge after they're out of the hospital to get them stable in a stable housing setting to then find them permanent supportive housing. There's also some other services like respite services, rehabilitation. Those are not, IEHP is not doing those in Molina right away, but they're doing all of the ones that I highlighted. Next slide. So the list keeps going, and it includes that example I gave of helping individuals get out of long-term care facilities where no one wants to be if they don't have to be, having had relatives cared for people as a physician, in those kind of settings, get them to home or another housing option. And it's the transition services. Also, you can do the tenancy services, the initial deposit, et cetera. So you can also see meals are on here, home modifications are on here, and those are all part of what IEHP will be providing as of January 22, and Molina as well. Next slide. So here's the things that are not covered through CalAIM and ILOS community supports. Except for recuperative care and post-hospitalization, it doesn't pay for direct housing costs other than that housing deposit. So that's still a challenge. And that's where I think you and your expertise and everybody, the providers that figure out how to, leverage vouchers, et cetera, need to be so much a part of this, because it doesn't pay for that direct housing. Now I'm going to talk about another funding source in a minute that may, and that may really braid in and make this work. If you don't have Medi-Cal, sorry, Josh, go back a little bit. If you don't have Medi-Cal and you're not enrolled with a health plan, you can't get the services. So it doesn't help. It doesn't pay for getting them eligible, working to get them eligible, and it doesn't pay for housing help other than the listed services I mentioned. So it does have its limitations, but is again paying for things that health plans have never, other than like IEHP did it on its own, have not been able to pay for. Next slide. So, these things are just things that the county could be involved in. And so right now, the plan is that behavioral health in the county, because of their expertise around housing of their members, are going to be one of our leads for IEHP and Molina around particularly the housing support, but may need to be augmented. You've still got the issue of actually paying for the rent or the, enhanced augmented services in a residential center for the frail elderly or assisted living, which is still a bit complicated. So clearly the need for, the connection to you, the CoC and all of the services that are part of it. I'll talk about in a minute. You're actually going to be, for another piece of funding, you're going to be an integral part of it. Next slide. Which is this one. So the state has asked the federal government for $4.6 billion in home and community-based funding. So it's Medi-Cal funding. It's a complicated way where the feds will give additional matching federal funds for current members. And so that results in about an additional $4.6 billion. The money has to be used by March 31st of 2024. So strategy is going to be important. 1.3 billion is going to come through health plans. And as I mentioned at the beginning, it's going to be probably a combination of, point in time counts, other metrics, but size of the health plan obviously will matter, size of the counties. But this is a lot of money. So thinking about IEHP specifically, it could be $130 million for a list of services and activities that I'm going to show you in a moment. But the planning is going to have to be done in direct conjunction with you. Next slide. So they've mandated that 85% of the money goes into the community. So the plan can use 15% for, staffing or administrative costs or whatever. 85% has to go into the community, which for this I think is a good thing, even as an ex-health plan CEO. Could work through you, could work, directly to members in terms of providing, subsidies, housing providers, obviously, counties, et cetera. So the money has to get into the community. This is really key. There has to be one homeless plan that's done by both health plans for each county. So Molina and IEHP will have to produce one homeless plan, and that plan has to be done in direct connection. You are called out as a partner in that planning, which of course makes total sense. County public health, behavioral health, DPSS, housing departments, et cetera, put together a homeless plan, one per county, that documents, delineates the services to be provided, the cost of those services, and then there will be metrics, and this is real key. There will be measurements and metrics that have to be met for the dollars to be drawn down. There'll be some money, probably the way they've done it with some other funding is some money just for the planning and assessment, and then most of the dollars for actual services will generally have metrics attached to them that the plans have to meet with, obviously, the help of you and the providers and everybody else, to draw down the rest of the money. So that's going to be really key. And the homeless plan should reflect, the achievement of those metrics, obviously. Very broad eligible populations. Next slide, Josh. And thank you for doing this. Appreciate your help. Very broad. Aging adults, individuals with disabilities, post-incarceration, individuals with SMI or SUD at risk for coming out of hospital, families, homeless adults, veterans. So this is a much broader group than is served through CalAIM. So you've got CalAIM money that is a fairly focused group of homeless individuals that are part of the healthcare system, generally would have chronic illness or SMI, so kind of a focused population that's served by the health plan. This is a much broader group than is literally served by the health plan. So thinking about this in a much broader way is going to be key in terms of that homeless plan. Next slide. So what happened with the proposal, which was interesting but potentially a little bit concerning, and I'll talk about it in a minute, is initially the proposal to the federal government listed out a lot of specific uses of the money. And it included things like a flexible housing pool, which of course could be used for rent or any other augmented payments to assisted living, board and care, et cetera. They took a lot of that out, and it's now a very general proposal. So it talks about these kinds of services. I mean, kind of straightforward: prevention, interim housing, rapid, all the things you guys know, permanent supportive housing, case management, which would include, of course, the medical piece, housing navigation, and tenancy. So if you think about it, you've got CalAIM dollars and community supports that reach a certain population for certain services. You've now got this HCBS money that augments that significantly, in some ways probably more money, in some ways time limited, and requires that coordination with the community, homeless plan, et cetera. So a much broader use of funds. But there's a key question that needs to be answered on the next slide. So the funds can be used for things that are pretty straightforward: identifying individuals with needs. So identification, outreach, referral, housing navigation, transition services, tenancy, care management, sport activities, capital development. I think that's actually a really key one because it's time limited money. So thinking about capital development, I think, will be a really important part of the plan and the use of the money. The one that's still in question, which is a little frustrating to everybody, is actual housing subsidies, rent, vouchers, et cetera. We think there's a way, well, depending on who the we is, we think there may be a way to kind of get around that issue that is not called out specifically. And that'll come out as we kind of develop, as you and the plans develop the homeless plan and think about the uses of the money, is there may be some ways to free up other dollars that could be used for the housing subsidies, rent, vouchers, et cetera, with the HCBS money replacing, other funding or funding that you don't have. So just be thinking about that, because it was clear in their first proposal that the money could be used for these things, which to me is the key need. yes, important to outreach, identify, transition, support, but, there's still that need, which IEHP directly did. I mean, we paid rent, we helped development, directly. We paid, augmented funding to assisted living. I mean, using just IEHP dollars. So it'd be really, we need to think through how to use these HCBS dollars for those things. And then, of course, there's a lot of different funding sources for these activities and housing. How do we make sure we're matching them all up and working with them together? But this is a fair amount of money. It is time limited, so we've got to think about that as you're working on the homelessness plan. But it's a new opportunity, I think, connected through the health plans. That's really kind of unique and exciting. Next slide. So really just summary, and then I'm available for questions. And I know this has been quick and a fair amount of information, but wanted you to get the sense that CalAIM is really pretty significant reform to Medi-Cal itself, Medi-Cal managed care plans, county delivery systems, and really the housing world. I mean, I'd add on there. Major work by all the parties involved. Lots of plans, lots of measuring of metrics, drawing down funds, et cetera. The cool thing from my perspective, as a physician and a public health person in my background, is it's really looking at the whole person. Instead of focusing on, do their medical care, it's really focusing on the whole person, of course, including housing, food, et cetera. I think it's going to make a difference. Let's make it, together. Let's collectively make a difference. And then, let's figure out how to complement it and braid and connect these other funding sources that are going to come through, both on the housing side itself, and then through the health plans, through the CalAIM money, and the home and community-based services money. So I think it's a real opportunity. We're going to, the plans are going to need your expertise big time. IEHP, as I said, has been in this space, but this is another level. And so, really thinking through how to do this right and working together. So I don't know how many of you know Gina Kendrick, who will be, part of this with IEHP. Dr. Takashi Wada, who's the chief medical officer, will be very involved, et cetera, et cetera. So that's what I've got for today. Really appreciate the flexibility about me, coming in the middle of your meeting. Hopefully was helpful. Happy to answer questions, and or provide any other information that would be helpful.
Dr. Gilbert, that was fantastic. Wow. It's an amazing opportunity. I'd like to open up the floor. Does anybody have any questions? I know this was a lot of information, but I'm sure as you were listening to Dr. Gilbert's presentation, you were already thinking of ideas of how we can start to tap into these resources and transform the Riverside Continuum of Care even more. So questions from anybody? Don't be shy. This is like really significant in terms of an opportunity, and we want to do everything we can to support our UHS and make this a success. Well,
really support, Karen, really support the health plans. I mean, Molina's not been in this space. Now they're pretty small compared to IEHP, but there's still going to be dollars flowing through them. And they have to get together, which they will. But really, you're going to need to support again, Ben Howdige's on the phone from IEHP. They know this space a little bit, but this is a countywide homelessness plan, which you guys have worked on and done and been involved in. Now this sort of for the plan to be able to, submit, get the funding and deliver.
Do you see that there's much of a population gap that in terms of people that are not members of IEHP or Molina?
I think there's probably a lot of crossover because, they cover between the two of them, they probably cover, 750,000 people in Riverside County, something along those lines. IHP has 1.4 million total, so it's about half and half. Molina has a couple 100,000. So I think your main need's going to be in that population. But there could be individuals, veterans, for example, may not have Medi-Cal, and they're allowable on the HCBS list. Although they have to be members. Karen, to your point, sorry, they have to be members for both programs. Yeah, you're right. So I think the majority of who we need to serve are part of those populations, but there's probably some outliers, which again, then you could use other funding for.
Do you have, pardon me, go ahead, say it again.
Sorry. This is Josh. I remember when I was working at a health clinic doing case management, I would say 99% of my clients that had Medi-Cal were enrolled in a managed health plan. Mostly IEHP out here in the Coachella Valley, but also several that were enrolled with Molina. But again, 99%. It was very rare that someone was enrolled with Medi-Cal without a managed care plan.
Yeah, so you've got, because they just expanded the coverage of undocumented individuals. So they'll be, not all of them, but a bigger group now will be Medi-Cal eligible and have to be in a plan. So Josh, I think you're right. I think the vast majority of who we collectively will want to serve will be in the health plans.
So we just want to be a resource and figure out how we can best support these efforts. And if you feel like there's going to need to be some subsequent follow-up training, it's very detailed and technical, it seems. So I would imagine probably there will need to be some more follow-up and training so that the providers that are serving the homeless and at risk will know how to best collaborate with the agencies and tap into these resources and fill any gaps that aren't funded. I think that's probably the key, since it sounds like you mentioned there are some gaps. It's not 100% of everything.
Yeah, no, and I would suggest, reaching out to IEHP in particular, because Molina will tend to just come along because their membership is not as big. Because you have to help with the plan. It's mandated, and you should be anyway. Don't get me wrong, but so I would think about, Karen, reach out to probably to Gina Kendrick or Dr. Wada that says, hey, we heard that we need to help with your plan. We'd like to start talking, because this money is going to come very soon and it has a time limit. So the faster we get organized, get the plan together, get it approved by the state, get the money flowing, the better. So I'd be, probably don't use my name. I'm just kidding. I'm just kidding. But I think you got to start now. And I think you think about the capital development piece, think about the ways to, use the money in a way that gets to some of the needs we have around the subsidies and the rent and such, through the providers, the housing providers and so on. So just some thoughts.
The timing is right. We are working on a regional homeless action plan, and the goal of this plan, it's supposed to roll out the first draft in January. We talked about it today, Dr. Gilbert, before you came on, and it used to be was a county plan and a continuum of care plan, and this is going to be a consolidated plan, and it's very comprehensive in terms of the gaps analysis and strategies and goals and metrics. So I would hope that all of the work and effort that's going into this particular plan may make it easier for this other plan that you're talking about.
Oh, big time. If I was the CEO of IHP, I'd say all we have to do is make sure the plan fits with, the metrics and delivery that's required from the state. Because, the Department of Healthcare Services will have its particular, metrics and things they're thinking about. So to me, it's an adaptation kind of thing. I think they'd love it. Karen, they would, I can't speak for them, but I would think they would love it, because this is what you do. And so I that actually is pretty exciting, because that means we might be able to move pretty quickly.
Yes, and if sounds like we might be able to do something where there might be some opportunities for tweaks as opposed to some secondary plan. We'll have to, the devil's in the details. So
always, yeah. So because DHCS will put out, their kind of parameters and what metrics they're thinking of, and then I think it's just sort of getting together with you, looking at that plan and sort of figuring out, because you've done the work. There's no need to duplicate it. That's why, frankly, that's why you were mandated to be part of this, because I think, in their wisdom, the state actually knew, wait a minute, these activities are already going on. We're just, I don't want to say the way it's going to sound, but we're just funneling money through the plans because we can.
I also wanted to comment, I think it's extremely exciting to have a focus on trying to move people out of institutionalized care. And it's not just seniors. I know there are folks that have chronic health issues and disabilities that are relegated to institutionalized care and skilled nursing. And if I understood what you were saying, this is going to help maybe to move folks out of institutionalized care. Did I understand that correctly?
Totally, yeah. And IEHP has been doing that for probably 4 years, but COVID, of course, caused all sorts of issues. But the answer is yes. The CalAIM money specifically calls that out. And I can't imagine that the HCBS money wouldn't be eligible to do the same thing. So, but the CalAIM money, as you saw on the slide, specifically calls out institutional transition. And that is, I mean, Karen, just one anecdote. We moved someone who had been in the facility for 5 years. We were able to successfully get them home, with lots of support, but got them to a home, which was just amazing. I mean, she did not need to be there for 5 years. It was just almost sad, but good outcome. So Bruce Weiss has a good question. So unfortunately, the state has not provided a lot of detail, or I would have provided that detail in my slides, but they will. And, the timeline will be fairly short. And again, the plan's going to have to come right to the CoC around that home and community-based services plan, homelessness plan. So that'll then kind of define the timeframes about the plan, how the money will flow, et cetera. So they haven't released hardly anything, which is a little frustrating because it's supposed to start in January and it ends in March of 24, right. But they will. And so then, the plans, that's why I thought reaching out to them and saying, I have a regional action plan, Karen, I think would actually reduce their anxiety level at the plans.
Well, we'll definitely follow up with the team that's working on this and definitely follow your advice. Looks like Bruce was wondering too if there's standalone funding that's going to flow through the continuum of care. And as I understand the way that you were explaining it, Dr. Gilbert, is this is really like an add-on benefit of Medi-Cal. So it would be handled through those providers, or are they going to subcontract with nonprofits?
Yeah, so CalAIM, and CalAIM will mainly go through providers, mainly medical providers.
Yes.
But the HCBS money can come any way the homelessness plan says it should. So it could come through the CoC. It could go directly to providers. It could go directly to members, for some kind of subsidy or some kind of support. So that would all be laid out in the homelessness plan. So the HCBS money, in my mind, has probably more flexibility, serves a broader population, and hopefully will be able to be used for more things, including, as I mentioned, rent, vouchers, et cetera. So that's the money that, I think Bruce is probably most pertinent in terms of CoC involvement, provider involvement, and that's where we don't quite know the timeframes and such. CalAIM's going to be, because of the nature of it, it's going to be more focused through, medical providers, behavioral health providers, et cetera. A little more focused through them.
Bruce, did that answer all of your questions?
That help?
Yeah, definitely. Thank you very much. I appreciate the answer.
Great questions. I just want to thank you for engaging, as this is like super important. This is like historical. I mean, really some amazing opportunities coming to the region. Josh, are there other people that have questions that I can't see? Or can you see anybody else that has their hands raised?
I see no. hold on one second. No, I see no other questions.
Okay, so that's just Bruce, right?
Yeah, so thank Greg Rodriguez for bringing me, which is great. Was really happy to do this because he heard me do this for the Community Health Center board. And so, thought, and it's so pertinent, especially then. That was back when the HCBS money was not really defined at all. And so now that it, of course, still got more definition to do, to Bruce's question, but at least there's enough to know. Lots of money for good services, to make it simple. Lots of money for good services to come through with big time CoC involvement.
Do you think all the FQHCs throughout the region are already know all of the details and are already starting to get engaged, or is there more work there?
There's probably a little bit of work, but most of them were doing what was called the Health Homes program, which rolls into the enhanced care management program. So most of them will have the enhanced care management, which means they're identifying individuals that are homeless or at risk of homeless. They're linking them with providers and services. So they're in pretty good shape. There's probably, as always, one or two that maybe weren't as involved, but IEHP is actively reaching out so that their patient populations get the enhanced care management services as well, because it's a benefit. So every Medi-Cal member that qualifies, that meets the criteria, is eligible for that benefit.
Great, thank you so much. It's truly a pleasure to have you here and to get to know you more. We appreciate all that you do to serve the county, and especially appreciate the presentation that you gave us today, sir.
Yeah, thank you, and really appreciate the opportunity. Let me know if I can, through Josh or Greg, if there's other information you need.
Absolutely, we will, I'm sure, be following up. Okay, so we're getting close to the top of the hour. Let's move on to the next agenda item. We're going to go back down to agenda item 5D. Myrelle Cabazon, did you have an update for us on coordinated entry? Oh, you're muted.
Thank you. I do have an update for everyone. If we can just go ahead and move on to the CES lead updates. Here we do have the updates. It is broken down by city, so you are all able to see. As you can see that we have made a lot of home connection referrals for the ESG efforts. About half or maybe a little bit more are ESG related. We also have been receiving an influx of VI SPDATs and calls to our 800 number due to the ESG efforts as well. So before moving on to the CES updates that I have to share here on my screen, does anybody have any questions regarding this data? Okay, I am not hearing any, so for the sake of time, I'm going to go ahead and share my screen here. I hope everyone can see that okay. So we have made a few changes to our VI SPDAT packets. Our VI SPDAT, all three of our VI SPDAT packets have been updated, meaning the individual, family, and the TAI VI SPDAT packets have been updated. Within the packets, there are new letter of homelessness templates, as well as an updated workflow, as well as additional questions, a page of additional questions that are found on the VI SPDAT assessment within Clarity, so that field workers are able to capture this information when out in the field. So here I did include a snapshot of the follow-up questions that are included within the VI SPDAT packet. Within this page as well, there is an updated workflow, which we have been implementing with our community partners at agencies when submitting VI SPDATs to Home Connect. So here I did include a couple snapshots of the letter of homelessness templates. The one on the left is just an updated version and a fillable template just to make it easier for our community partners. And then as well on the right, there is a new homelessness template. It is a professional attestation to presumed homelessness to be used when a client could not self-attest or self-certify their own homelessness. We have also been facilitating a Clarity Basics 101 training for not just our staff, but also agency partners, so that agency partners as well as staff are more comfortable with the data entry and using Clarity on a day-to-day basis. There are a few changes within Clarity. We have been working closely with our HMIS team leads to have the community queue enabled. We have also added additional fields on the CES program level, so we are able to capture case managers as well as VI SPDAT assessors, because we have found that sometimes that the VI SPDAT assessor is not necessarily the case manager. So we did want to go ahead and capture this information when agencies are enrolling their clients in the coordinated entry system program within Clarity. We have also been completing the data entry of the by name list within Clarity so that we are able to get off of the spreadsheet of Clarity. I'm sorry, the spreadsheet of our by name list. This data was captured about 2 weeks ago. So about 2 weeks ago, we did make, Home Connect staff has been actively making Home Connect referrals for the ESGCV efforts. As of 2 weeks ago today, there were 132 referrals that have been made. And then we went ahead and broke it down by district. So 41 for District 1, 28 for District 2, 15 for District 3, 42 for District 4, and 6 for District 5. Another update is in regard to our CES Community Partnership meeting. Just as a reminder, there has been a new name adopted. It has changed from the Navigation Review Council to CES Community Partnership meeting to help better encompass what is done within the meetings. Also, there will be an updated calendar invite that will be sent. We are working with our IT team right now to cancel and completely delete the one that we currently have. That way, we are able to hopefully not confuse anybody with the new calendar invite. We have also been working to have more presenters within our CES Community Partnership meeting, as we have found that it is a helpful resource for our community partners and agencies. So that does conclude, I'm sorry, that was quick for the sake of time. That does conclude our CES updates. Does anybody have any questions for me?
Before I open it up the floor for questions to technical, what would you say to case managers who had clients that didn't initially give multiple co-occurring diagnoses on their VI SPDAT and then later admitted that they had multiple diagnoses that would affect their score on VI SPDAT? What do you tell case managers when that happens?
So if there is a significant change from the initial VI SPDAT, then the individual does need to be re-SPDATed. The only time that agencies should re-SPDAT an individual or family is when there is a significant change that could greatly impact their score, meaning increasing or decreasing the score. So that is the only time that we recommend for a re-SPDAT. Of course, if anytime that any of the information changes, you can just definitely go back into Clarity and update that. You are also able to delete any previous VI SPDAT or modify the VI SPDAT. So it is something that can be updated at a later time if something does change.
Great, thank you. Does anybody else have any questions? Good job, excellent update. Thank you so much. All right, we're going to move on to the next agenda item, which is 5E, the Housing Resource Update. I kind of alluded to it already, and that is we are continuing to monitor federal and state funding resources that are coming down the pipeline that would support the development of all different models of housing. We know we need that for the continuum, whether it's permanent supportive housing, multifamily affordable housing, rapid rehousing, really every model. We want to keep our ears to the ground. And also, I mentioned to you that Michelle Davis did that great job on developing that spreadsheet, and we'll make sure we continue to get information out to you as the money is coming down the pipeline. Any questions on the housing resource update before I move on? Okay, the next agenda item really are just informational items. So you already heard our wonderful Continuum of Care staff talk about the report that is in the Google Drive. Also, their committee reports are in the Google Drive. We do not have any requests for letters of support at this time. We always share those with you when we do. In the Google Drive, you can see there are a series of the annual performance reports for your review. I encourage you to look at them because these folks are working really hard to serve people throughout our region, and you can see how we're tracking in terms of performance. So any questions on those agenda items? Okay, hearing none. This time under agenda item 7 is the call for agenda items for the next meeting. Does anybody have any requests for agenda items for the meeting next month? We aren't dark next month, right, Josh? We do have a meeting in December. Yes.
Correct.
Yeah. Any calls for agenda items? Okay. You guys are quiet today. Does anybody have any exciting announcements? Anybody have something that they're just so happy they want to tell everybody, something cool that's going on? Some new program, some new accomplishment, something, anything? Going once.
That are on the screen, Karen. These are both tomorrow. So I just wanted to put those on there so it's fresh in everyone's mind. We have our monthly multidisciplinary approaches to ending homelessness webinar. Melanie is so gracious to put these together. This month's topic is runaway youth awareness. So Operation Safe House will be presenting, and I believe the Riverside County Office of Education as well. Also in the morning on Thursday, which is tomorrow, our monthly Youth Advisory Committee and Youth Action Board, sometimes we refer to as the Yak Yab. If you ever hear us say that, that's what we're referring to. It is a standing committee meeting that focuses on youth and youth homelessness. That's tomorrow from 10 a.m. to 12 p.m.
Awesome. Well, before we adjourn, I also wanted to thank all of you that participated in the survey to give Greg and I feedback about just how the Continuum of Care meetings are structured and what we can do to better serve you and working with the staff. We will have a future report out on the results of that survey and have an opportunity to collaborate with you more as we're visioning and moving into the next year. It is our desire to do everything we can to serve you and support you in all the great work that you do to serve folks across the region. So we thank you for that. And I just want to say thank you all for participating and staying on today. It looks like there's some updates in the chat box from David Jacobs. So thank you so much. We appreciate the information that you're providing. Does anybody else have any other comments, questions before we adjourn the meeting? Okay, thank you all for being troopers and participating. We appreciate you all more than you know. Have a great rest of your day. Meeting is adjourned.
Hey, Josh, this is Kimberly. Can you hear me?
Yes, I was muted. I'm sorry. Hey, Kimberly.
Hi. So Karen's still on too. So I didn't want to say this to everybody, but I sort of did like a little mini project with Scan Healthcare, which is for seniors. It's one of the Part B plans. They gave CVRM $10,000, and they said, go find people that need things in their homes done that they can't afford, for that they're old people. The criteria was a maximum $1,000, 62 and over, but you could have one that was under 62, like 55. And I went to every single senior citizen place to see if I could find them. I didn't find them there. I went to IEHP and talked to their caseworkers, and so I formed a partnership with, so they can have somebody install like grab bars or ramps and things, but they couldn't pay for it. So I was able to pay for it, and then they would pick it up and install it. It was like such a cool thing. I mean, it wasn't tons of money. It was $10,000, but I can see how this, what's it called, that CalAIM,
yes,
would be an awesome thing. So we have a piece of this, and then we have a piece of this. Now we have something that fills in that piece. I am very excited. So if because I had to work this out all by myself, Karen, but whoever's putting this together for the county, call me.
You know what? Thank you for sharing that, because home modification programs really help older adults. I have a passion. I was involved in older adult programs for many years. The more that you can provide community-based services to keep older adults at home, and home modifications will help for people that have balance and mobility issues. It could be a game changer for someone. So I think that's just a fabulous example of how with a small amount of resources you can really change someone's life. And I agree with you. I think that what we heard today from Dr. Gilbert, there's so much in the way of opportunity. And that was a lot that today, that was like, I think probably you felt like you were drinking water out of a fire hydrant, because he is so knowledgeable and there's a lot of resources coming down the pike. But we're gonna, you have the support of the amazing county staff, and Greg and I, and of course, and even the BOG folks. Will do everything we can to make sure we do this right, to keep everybody updated and do what we can to try to tap into these resources. So those are the kind of success stories that we need to hear about. So thank you for sharing. I hope we can hear more of those, because we need to learn from you guys too. I know you have lots of things we can learn from you.
Well, with this, I think I was sort of a lone wolf on this, but the people from IEHP were so amazing and their installation staff. We did garage doors, we did roofs, we did a car repair, we did we had tons of people that had no clothes or underwear, that are old people living in a home that had holes and everything. So we went and bought them stuff, dropped it off. It was really, really rewarding, because, you hear about this all the time, the elderly just stuck in their homes and nobody's there they don't need $10,000. They don't need $5,000. They need 100 or 200, and maybe 1,000 over a year, and they would be able to stay 10 more years in their house.
Absolutely. I used to administer a program like that, because I used to oversee the Office on Aging in Orange County. And that might be an opportunity for a follow-up discussion with our Riverside County Office on Aging, because they get so many calls through their call center of either caregivers or older adults that are in need of support. So I hope that that's the beginning of a conversation we can advance. So thank you for sharing that.
Yep. Okay, Karen. I don't mean to keep you guys waiting. Thanks, Josh. Good seeing you again today.
Thank you so much.
All right. I'll talk to you guys later. Have a good evening.
You too.
All right. Bye-bye.